You can go ahead and get started, Rep. Russo. You're muted.
Thank you, everyone, for joining our monthly Ohio Children's Caucus presentation. I'm very pleased to be here with I think both of our vice chairs, Senator Vernon Sykes, I see, has joined us, as well as Representative Manchester. I did see my co-chair, Senator Coonsey, but I also see several members of the General Assembly and members of our caucus who have joined today. Very excited to be talking about this topic that we have covered once before during last General Assembly, but it is still a very timely topic on lead exposure in children, given new research that is specific to Ohio and puts us in a place that I think is very unfavorable in terms of lead exposure in this state. So lead exposure, as we know, poses some very devastating consequences for children, especially young children, as they grow and develop physically, neurologically, cognitively, and behaviorally. And it also heightens the risk of long-term chronic conditions later in life. More than 3,500 children in Ohio were diagnosed with elevated blood lead levels in 2019. According to the Ohio Department of Health. And we also know that for 90% of Ohio's children, this lead exposure was caused by lead-based paint, dust and chips in older homes. And we also know that more than 650,000 lead pipes that deliver water to Ohioans across the state also still have those lead service lines. This figure once again captures Ohio an unfavorable ranking, in that we are now the second highest in the country for the number of lead-containing service lines in our water system. And according to Ohio's Lead-Free Kids Coalition, Ohio's current funding levels for lead hazard control and lead abatement mean that it would take over 141 years for Ohio to make older housing occupied by young children lead safe. But we know, given the consequences of lead in the long term, that now is the time to address these issues to keep our children safe from lead. So I am very pleased to have three distinguished panelists. We have Dr. Harvey Kaufman, who is the senior medical director and head of the Health Trends Research Program for Quest Diagnostics, who is going to be presenting first. He will be followed by Dr. Matthew Tien, who is co-chair of the Metro Health Lead Coalition with the Metro Health System. And then we will get final comments from Timothy Johnson, who is a policy advocate for the Ohio Poverty Law Center and is representing some of the work that the Ohio Lead-Free Kids Coalition has been doing. So with that, I'm going to turn it over to our panelists, and we will start with Dr. Kaufman.
Thank you, Allison, and thank you everyone for being here today. The good news or bad news is that none of us are going to live 141 more years. So let's go to the next slide. So I congratulate Ohio. Ohio is a leader in terms of lead poisoning prevention. And there is an Ohio law that requires healthcare providers to administer blood lead testing to children 1 or 2 and up to age 6 who had previously not been tested, particularly children on Medicaid, live in high risk zip codes. That's a bit challenging if one doesn't have the information on the zip codes, and then certain other risk factors. So, but again, congratulations to Ohio. Next slide. In terms of where I'm coming from, we had a study that got a lot of press that was published in 2016. That was a journal of Pediatrics looking at blood lead across the country. And then a more recent publication, September 27th, online and soon to be for real, in JAMA Pediatrics, looking at lead across the country from October of 2018 through February of 2020. We stopped before the pandemic had any impact. And there was an amazing editorial with first author Phil Landrigan, who worked with Dr. Herb Needleman, who is the pioneer in terms of understanding the consequences of lead levels. Next slide, please. So first, I'm going to start with the review of the 2016 study. Ohio was ranked 4th in the states, not unexpected. And if you just look at the collective May 2010 through April 2015 data, about 7% of children had an elevated blood lead level of 5 or greater. In the early period, it was about 9%, and the later period is about 6%. Average was 7%. And 1 2/3 of the percent of children had levels of 10 or more. Now, compare that to the more recent study where it had 5.2% had elevated blood lead levels of 5 or more. So it has come down from 7 down to 5. And nationally, we had about 3% previously, and the new study is 1.9%. So similar kind of, 1/3 kind of decreases from the earlier study to this study. One of the key aspects of the more recent study is we were able with our technology to get down to levels of 1. And now there is no safe level of lead. So looking at levels of 1 was sort of interesting. We didn't know what to expect. And what we found was, of children tested throughout the US, 1.1 million children, just over half had detectable blood lead levels. And Ohio was in that same general range. Now, the other party to look at is the CDC data, which is reported by Ohio to the CDC. There's a caveat, which I'll explain next, but the bottom line is, however one takes the data from the CDC, Ohio is definitely a bit above the national average. And the reasons are clear. If you go to the right-hand side, the key drivers in our study, we did this sophisticated regression analysis, and the 3 key factors are older housing. We looked at pre-1950 housing. The lead paint was outlawed in 1978. So one can look at whatever one wants to, but in terms of what year. In Ohio, 2/3 of housing is from 1980 or earlier. So there's a lot of old housing still in Ohio. And it's going to be a while, hopefully not 140 years, to sort of address that exposure. And the other independent drivers are poverty and Medicaid. And it's unclear what it is independent of housing as to why children in poverty and Medicaid are at increased risk. But one of the factors may be that there's higher rates of iron deficiency, which increases absorption of lead. But there may be increased exposure for more duration among those in poverty and Medicaid. And just to hit on these factors, again, old housing, high percentage in Ohio. Ohio has above the national average in poverty, and the Medicaid, 3 out of 8 children in Ohio are on Medicaid or CHIP. So these are all factors that contribute to the situation in Ohio. Next slide, please. So I just want to differentiate the CDC listed data with which some people have access, everyone has access to, but some people refer to versus what's reported in the governor's report. And I went over these numbers with John Belt and Christopher Alexander this morning. The difference between the two is whether or not it's confirmed or not confirmed. And so one's got to be careful in differentiating what data to look at. But the next slide sort of shows you where the trends are. And so the left-hand side is from that governor's task force report showing that from 1999 through 2018, if you look at levels of 10 or greater, there's been a 92% improvement. Dramatic. This is incredible. Great, great progress. And that's likely to be reflective when we look at lower levels as well. The right-hand side is CDC reported data. So don't get hung up in terms of the absolute numbers being shown, but more of the general trends. The stars are the Quest Diagnostics data from particularly the earlier reports, the first three blue stars, and the last one is the more recent report. But the trend is down, dramatically down. And then the US trend is dramatically down. Relative to the US reported data, this is 80% of kids tested in the US, covered lives, kids in the US, and they're both down, for all intents and purposes, 50%. When we look at values of 10 or greater, whether we look at Ohio or US, they're both down around 30%. So again, both Ohio and the country are making great progress. Next slide. And I think this is the last. So the takeaways. Ohio is among the best led programs in the country. You should be proud of that. Long history of progress. Don't get hung up with different data sets. The Quest Diagnostics is a small sample of total testing in Ohio, but the trends I think are good because they're consistent with other trends reported. Stick to one set. That's the one that's reported in the Ohio Healthy Homes, the poisoning prevention program is the one I would recommend you just stick with that. And then the reality is there's a lot of old homes in Ohio. Number 2 in the country in terms of lead pipes, only second to Illinois. High rates of poverty, high rates of Medicaid and CHIP programs. Ohio, like most of the country, has a high percentage of kids, half or so, that have detectable leads, and we know that there is no safe lead level. Great progress. More is needed. Thank you.
Thank
Dr.
you,
Tien. Yeah.
Dr. Kaufman. Yes, and so next we're going to have Dr. Matthew Tien, who is with Metro Health System. So thank you, Dr. Tien, for being with us today.
Thank you so much for having me. I'm coming through okay here. I'm talking to you from hidden away in an exam room. If you hear.
Yes, we can hear you just fine. Okay. Thank you.
Okay, thank you. It was really a pleasure to be here. Really enlightening to hear Dr. Kaufman's data, and that really helps spotlight that the lead continues to be an important issue here in Ohio, especially among our most vulnerable children. So I love looking at the big data, but I first wanted, for my portion, I want to take a quick step back to start with and talk about lead testing and management from the perspective of a primary care pediatrician. Dr. Kaufman also referenced these Ohio guidelines for lead testing that I'm showing here. I've worked almost for 20 years now in various clinics all across the country. In the last 10 years, I've been here at Metro Health, which is a safety net hospital system serving patients here in Cleveland and the Cuyahoga County area. This picture here is one of my wonderful pediatric colleagues, Dr. Sarah Abatement, giving a cute little guy a checkup. There's a lot to juggle at child's appointments, from talking about growth and development and immunizations and everything. And we know lead testing is important on that list of to-do items. In Ohio, as Dr. Kaufman mentioned, there is some, it's not like some states where like every child at 1 and 2 years old needs a lead test here. There is some nuance to it, trying to figure out, do they live in a high-risk zip code? Do they have Medicaid insurance? Do they have some of these other risk factors and such? But we found over time that most doctors are pretty good at remembering to order the test when it's due. But what happens often is that the wary parents, after they've been waiting for you for a long time, now you've given their kids shots, now their kid's crying, now they put the kid in the car seat, now they have to go wait at a lab. They often do not get the lead test done. And I'll show you some numbers in a bit to reflect that. Next slide. So last year, I was part of a group of pediatricians from Metro Health that participated in a lead quality improvement project organized by the Ohio chapter of the American Academy of Pediatrics. It was a great experience to learn from some of the leaders we have here in Ohio on pediatric environmental health, see how other practices and hospitals are dealing with lead. Here's a little cartoon that I drew from another presentation that shows me learning lots of stuff on those Zoom calls, so I'll let you be the judge of my artistic abilities. But a big focus of those sessions was talking about how to improve the rates of getting that lead test done. And you can see in the lower right-hand corner, they've cited that 40% of high-risk kids don't receive their recommended lead test. So how can we improve on that? So we spent a lot of time sharing ideas and best practices. Next slide. So when that quality improvement project wrapped up, just coincidentally, Metro Health committed to taking on lead testing in children as a system quality goal. Often hospital systems have a number of different goals that they sort of have as their priorities. And this year we were fortunate to have lead testing as a system quality goal. We use this metric of trying to maximize the percentage of patients with a lead test by their second birthday. As you can see by our baseline number before we got started at 57%, we had a lot of room to go. We found that it was really useful, even though Metro Health has a long history of working on childhood lead prevention and testing and care, to sort of reorganize ourselves and corral ourselves together, all the different departments, all the different locations that were working on lead in their own way, to sort of organize them under what we call the Metro Health Lead Coalition. This way, Department X would know what Department Y was doing. We could sort of really synergize and be coordinated. And it also gave us the opportunity to make sure that our organization was aligned with all the other efforts going on at the local, the county, and the state level on protecting children from lead. There's so much, I think, momentum right now to try to help improve this situation. And so today's Zoom session is an opportunity for us to just interface with you guys as legislators. Next slide. So one of the main things that we did as a system, it sounds simple, but we stopped sending kids to the lab to get their labs drawn, and we just drew it in the clinic. It's not rocket science because other health systems have discovered the same thing. It's a lot of work. As you may have heard, a lot of our nurses and medical assistants, we're short-staffed in our clinics right now here, so trying to give them an extra thing to do isn't easy, but because we had it as a system priority, we really were able to sort of get folks all on board with getting the lead drawn in the clinic. And this, at the top here, we see a snapshot of the report that we circulate to our different locations and say, Clinic A, how did you do on getting all your lead tests ordered and drawn on the patients who are due? Clinic B, how did you do? And the different clinics can have some healthy competition with each other, and we can sort of help out the sites that are needing some extra help and learn from the sites that are doing well. At the bottom, we can see some of the statistics that show what's been working for us. Prior to our efforts, the lead getting drawn on the same day of the visit for our system overall was 49%. So that means if you showed up with your child was due for lead, there was only a 49% chance it was going to get done that day, even though it was ordered most of the time. Now we've got it up to 72% after this past 9 or 12 months of working on this here. So we'd like it to be even higher, but we know that we've made a big difference on getting that lead test done, not missing those opportunities to draw it in the clinics. And for that metric that I talked about, the percentage of patients with lead done, at least one lead test done by their second birthday, we've gone from 57% as a system to 65% is projecting to end this year for our kids turning 2. I know that doesn't sound like the hugest margin, but for these large patient population metrics, that's a big jump. Next slide. I'll let you advance if you can, or maybe I'm on a lag. Let's see. Well, I'll talk about, I can talk without the slide coming up, and we'll wait for it to come up. But basically, it's wonderful news that we're making some gains on lead testing rates. But the other thing that keeps me up at night these days is that we're trying to be more systematic and thorough about care of the patients who have elevated lead. As we're doing more lead testing, we're just continuing to find more and more kids who are tested with elevated lead. And we get, at Metro Health, we get 10 to 20 patients a week with elevated lead test results. So we've really done a lot to hire a dedicated pediatric lead nurse. And now we actually have a new community health worker who's helping us to do care management and outreach for those patients with elevated lead. We have a metric that we use now to keep track of the patients with elevated lead. Are we getting them back in for their timely follow-up appointments? So that's trying to hold ourselves accountable, not just letting those kids slip through the cracks. We also have our pediatric lead clinic for kids with a lead level of 10 or higher. We really try to get those kids all the resources that we can. Many of them qualify for a neuropsychology evaluation to get full educational testing so that they can get all the support services they need down the road. We have a medical legal partnership. We're trying to get them plugged in with housing resources when we can. I'm happy to talk about that more during our question and answer. So I apologize about some of the technical difficulties, but we're really grateful to all of those folks who have worked really hard to make so much progress over the decades, like Dr. Kaufman's data was showing. And we still know we have a lot of work to do, but we're glad to be able to have this opportunity to present some of the stuff that we're doing to you and to continue to collaborate with others in the region and the state. I'll hand it off to Timothy Johnson. Can't wait to hear what he gets to talk about, and we look forward to more discussion with you guys afterwards. Thank you.
Thank you, Dr. Tien. And my apologies about the slides. I think we may have lost Allison Paxson. So hopefully we'll get that sorted in just a moment, getting the slides back up so they can advance. So our next speaker will be Tim Johnson, who is with the Ohio Poverty Law Center, and he is going to be talking a little bit about some of the work being done with the Ohio Lead-Free Kids Coalition. And one of the important pieces that I forgot to mention at the top, and I think Tim is probably going to talk about this, is the recent national study that showed that elevated lead levels in children in Ohio are more than 2 times the national rate, which puts us at the second highest state nationally in terms of elevated lead levels in children. So children in Ohio are at a particularly high risk for lead, the presence of lead. So Tim, go ahead, and I'm not sure if you had slides. We'll try to get those back up in just a moment.
Certainly, and thank you, Representative, and to everybody having me here this afternoon. I did have slides, but I have sort of a printout I can go off of as we sort of figure out all the fun technical difficulties that involve doing this remotely. So appreciate everybody's patience, and thank you all for welcoming me here today. So just to start off, the Ohio Lead-Free Kids Coalition is a collection of organizations and individuals who share a deep and urgent concern about the lifelong effects of lead. And we work collaboratively toward a meaningful public commitment and investment to ensure that all of Ohio's children are lead-free. We are over 40 plus members strong right now, and we're growing all the time. So if there are organizations attending and listening who are interested in Lead-Free Coalition, feel free to reach out to me after this. Be happy to speak with you. And just for folks who may or may not be aware, back in February of 2020, which feels like forever ago now, the Ohio Lead-Free Kids Coalition released a 9-point action plan on how we can move Ohio to becoming a lead-free state by 2030. If anybody is interested in taking a look at that, you can find that on ohioleadfreekids.org. All right. So the first thing I want to sort of start out in talking about is the current investment the state of Ohio has made in its lead poisoning prevention efforts. I'm going to start by sort of running over some things in the most recent budget that have been appropriated for the purposes of clearing out lead hazards. So first up is a new $6.5 million investment in each fiscal year in the Lead Abatement Fund. Would just briefly like to thank all of the co-chairs of the Children's Caucus, as well as any other legislators on the call here for being willing to appropriate that. That is a historic investment by the state. We're very happy to see that. The fund goes to multiple different things, including some of it being earmarked for the city of Toledo and their lead abatement efforts. Also, some of it goes to implementing recommendations from the Governor's Lead Advisory Committee. But the bulk of that funding is going to the Ohio Department of Health to establish a first of its kind grant program, which would give funding to governments and nonprofits to either expand on the work they're already doing in the lead free space, or to help local communities start their own lead hazard prevention programs if they do not have the funding or resources to start them on their own. So very grateful for that investment from the state. It was certainly needed. It's been something that the Lead-Free Kids Coalition has advocated for a long time, and we're very happy to see that came into fruition. Also available is a $5 million tax credit in each fiscal year that goes to homeowners to help them do lead poisoning prevention work in their home. That was first created back in 2019, I believe in the FY20 and 21 budget, and that was carried through to this budget. We're certainly happy to see that continue. There's also $5 million in SCHIP funding. The SCHIP lead abatement program is one of Ohio's strongest programs in terms of primary prevention. And what that means is getting to the source of lead poisoning and remediating those hazards before a child is ever lead poisoned in the first place. Because as right now, a lot of the action the state tends to take happens once a child has already been lead poisoned. So this program helps stop our kids from being the proverbial canaries in the coal mine and really tries to put us out in front of that issue. There's also $1 million each year for the city of Cleveland to continue their work in lead poisoning prevention. And I know that doesn't sound like a lot, but the city of Cleveland has done just tremendous work leveraging that funding to pull in private dollars. And they've done some fantastic work and really can't wait to see what they do next with that funding. There's also $22.3 million in EI funding, a small portion of which, not the whole thing, goes to kids between the ages of 0 and 3 who have elevated blood lead levels. And then finally, there is $10 million in each fiscal year for the Ohio EPA as part of the H2 Ohio program for some lead service line replacement. We talked about that. So based on those investments, I do think it's important we sort of juxtapose that with the need that's out there. And I'm not going to really belabor these points because they've been sort of hampered on by other panelists and have been talked about. But our investments don't quite match the scope of the problem that we have currently, unfortunately. We do know, as has been said, 2/3 of our housing stock was built before 1980. Which translates into about 420,000 plus children under the age of 6 living in homes with potential lead hazards. We also know that the state of Ohio is number 2, only behind Illinois in terms of the number of lead service lines delivering drinking water into homes. And Rep. Russo mentioned this at the top, but a new study shows that we rank number 2 in terms of the number of kids who test positive for elevated blood lead levels. Testing at more than twice the national rate. So we certainly have very good investments right now in Ohio, but they just don't quite match up with the scope of the problem as it is right now. And unfortunately, I had a slide I was going to show you sort of outlining the maps of where this area or where the areas of issues exist in Ohio. But I'll just go ahead and briefly say that this is a statewide problem. You will see issues like this concentrated in some urban centers, mostly in brown and black neighborhoods that have seen historic neglect, but it's in our rural areas too, and at very high rates there as well. So this is not just an issue that's concentrated in one part of the state or the other, it's statewide. Every one of your districts, the legislators that are listening probably have some sort of lead poisoning issue, whether or not folks are aware of it. So what can we do now that there is some additional funding made available for the American Rescue Plan Act? One of the things we can do is put money into the Lead Poisoning Prevention Fund. And this was a fund that was created all the way back in 2003. And it has yet to actually ever have any investment from the state. So any folks doing quick math on that will know that is 18 years that a fund was created in order to help with the cost of lead abatement, making homes lead safe, that has not been funded. And so this is an opportunity to actually put funds in there to allow local communities, to allow nonprofits to really access that money, be flexible with it, do it from everything from abatement efforts to window replacement programs. They can do things like offer funding for families to relocate while lead work is occurring in the home, all sorts of uses that these funds can go to that are currently, the fund is currently set empty. So we would highly encourage the legislature to consider putting some money into the Lead Poisoning Prevention You could also do some things to help increase the usage of the lead tax credit. Right now it's good, but it could be great. Things like allowing the lead tax credit to go towards lead service line replacement, which currently it's not allowed to do. Making it refundable, so those who have a low tax burden are able to actually make use of it. You could also explore who's eligible for it. Right now, it's only for individual homeowners. So Tim Johnson, a homeowner, could take advantage of it. But if I were Tim Johnson Properties LLC and I had several rental homes that had lead issues in them, I couldn't make use of the tax credit. So taking a look at that is something that the state or something that legislators can also do. You could also increase the funding for SCHIP. This is something that we talked about quite a bit during the budget that unfortunately we didn't see come into fruition. Oh, there we go. We're back. Very good. So increasing the amount of SCHIP funding. SCHIP has not quite been able to completely live up to its full potential as a primary prevention program because some of the funding goes towards homes where a child has already been lead poisoned. And I looked at the public health warehouse data from just this morning, and there are over 1,100 homes right now that have an order to vacate because the child was poisoned and the property owner has not fixed the issue. And so as we're trying to catch up on those, additional funding to that effort will be greatly appreciated so SCHIP can sort of focus on the primary prevention efforts, which is what it was originally designed for. And then lastly, back in June, the legislature passed House Bill 168, which would appropriate $250 million to the Department of Development to create this water and sewer quality program. And I am not sure if that funding is going to be allowed for lead service line replacement, but even if it is, it's certainly not enough to catch us up to where we need to be. Clean drinking water is essential to life, right? Everybody should have access to drinking water. We don't want situations that we see in Flint. And I know last week there was another Michigan town that was in the news as well about having unclean drinking water. So while the current investments, especially the ones passed in June, are good, the state could always do more. Next slide. All right, and so ARPA dollars do represent sort of a once in a lifetime opportunity to make significant investments within lead, but it's not going to be possible if we don't have the workforce to do this. And this is a serious problem. We need to build a strong workforce for lead poisoning prevention. So Ohio needs to engage on this issue with the Department of Development. And they should work in the growth of the lead abatement workforce by reaching out to community action agencies and nonprofits, contractors, vocational schools, community colleges, and recruit folks and train them and assist them in the cost of being trained and certified in order to do this work. And if you invest money continuously so that folks who are being trained into this work know that there's funding available to do the work they're being trained to do, we'll be able to sort of build up our workforce, which right now is fairly low because there hasn't been a consistent investment in lead poisoning prevention to create the workforce that we need. And we should also continue our efforts to make sure that there's funding available for the Department of Health to help subsidize the training and certification costs with RRP. I know the state legislature declined to allow Ohio to administer its own RRP program in this past budget. But it is required by federal rule that all contractors performing work in a house built before 1978 be trained to do so in a manner that's lead safe. So making sure that we are working with our current workforce so that they know the practices, they're trained to do things in a lead safe manner is extremely important as well. So continuing to make funding available to the Department of Health for that training and certification costs so that more contractors become certified and trained in this is incredibly important. And then next slide. All right, so I'll just close by saying Ohio stepped up in the most recent budget and placed a very big emphasis on lead poisoning prevention. Again, thank you to all the legislators on this call who have worked extremely hard to put money towards this effort, including the governor as well, who this has always been a priority for. But even these most recent investments by the state are not going to be enough. ARPA dollars represent an opportunity to make some headway on this issue, and the state should use ARPA dollars in order to do lead poisoning prevention. It makes a lot of sense. It literally represents a cost-saving opportunity. It's estimated for every dollar spent on lead poisoning prevention, there's a $17 return. And I want to make it clear that not doing lead poisoning prevention actually costs the state money in the long run. It doesn't actually save us anything. The problem is not going to be fixed overnight. And I know we talked about the scope of the issue and how large it seems and how it can be daunting. I know sometimes it feels as if we're never actually going to be able to get a hold on this problem. But I want to let folks know that that's not true. We know that kids get lead poisoned when they are in the presence of a home that has lead hazards. But if you do the work to make the home lead safe or do lead abatement, a child will not become lead poisoned. So we know that it is possible to prevent lead poisoning. It is not a question of can we do it, it is a question of will we do it. And I think with sustained investment and continuing to work on this issue, we will move Ohio to a place where it is lead free and every child can grow up without having to worry about the hazards of lead. So thank you all for bearing with me through the slides and not slides and all of that, the fun issues, but appreciate you having me here this afternoon. And I'm looking forward to any of the Q&A portion and happy to answer any questions.
Well, thank you so much to our panelists for that very insightful information, very helpful information. Tim, especially, some recommendations for paths forward, I think is incredibly helpful to this audience. I do want to turn it over to one of our vice chairs, my colleague, Representative Susan Manchester. She is going to moderate the Q&A. So Rep. Manchester.
Great. Thank you so much, Representative Russo. And thank you to all the panelists for that great presentation. I know that we all certainly learned quite a bit from this. I would just ask participants, if you have a question, please put it in the Q&A or the chat, or if you'd like to raise your hand, that's also doable. And we will do our best to get to everyone's questions. So this question was posed during Dr. Tian's presentation, but I believe it's probably relevant to all the panelists. How can partner agencies assist in increasing testing or awareness of testing, or how can we help with you in your capacity? Again, we'll start with Dr. Tian for an answer.
Hi, thanks for the great question. Well, there's been a few areas that we feel like collaboration could help us improve our testing rates. One is that we've worked a little bit with Medicaid managed care panels and trying to figure out, what can we do to help work together to get patients in for lead testing? They have incentives that they can offer. Sometimes there's referral programs that they can give so that they can tickle us so that we can try to help track down patients. So that was one area of opportunity that we love to explore more. Another area, I don't know if you guys have access to a few supplementary slides that I put in there that I had sent to Allison Paxton. If they're not up, that's totally fine. But one other area that we found is that when we're trying to improve our lead testing rates, there's two buckets. One bucket is the area of trying to not miss opportunities. When they're in the clinic, make sure we get them tested for lead, which is sort of what I spoke about. But the other is, especially during this pandemic, there's patients that we just haven't seen. We don't know where they are. We don't know if they've been hiding out because of the COVID pandemic. We don't know if they've been under difficult circumstances, like many of our families are, and just haven't come in for well child care or checkups. Or we don't know if they've actually gone to a different healthcare provider to get tested. And so this summer we took on a project where we had several thousand patients in our patient panel that are turning 2 years old. We looked up nearly 1,000 of them that didn't have lead testing on we looked them up one by one on the state immunization database, where individual lead data is kept. We, thank goodness, we had two very hardworking undergraduate interns who were willing to do that. And we were able to find that almost 200 of them had lead testing at outside other institutions. So when we're trying to track down patients who haven't had lead levels, we would love to know who's really had a lead level done somewhere else. we're working with folks at ODH, Chris Alexander, and I have exchanged some messages about how could we get some sort of more interactive interface where we can query on in one large query to see like who are the patients in our healthcare system that we need to reach out or who already have lead testing done that we don't need to reach out. And if we could have a little bit of a more productive interface instead of having to look them up one by one, that would also behoove us in our efforts to try to track down all our patients. Those are a couple of things off the top of my head.
Well,
Yeah,
thank you.
This is Dr. Kaufman. Let me just jump in. I mean, other things just to think about is whether or not cost is an issue is basically provide free testing, provide testing in terms of preschools or libraries or churches, religious places where people congregate. The comment on the pandemic, I was intrigued by. Last year, a lot of cities across the country suspended requirements for testing for entry to schools, but those have been basically put back in place for this school year. But we did see a significant, about a 15% decrease in testing in 2020 relative to 2019. And I love the idea of tracking down families and children to see where they may have received testing and to encourage them to get testing if they haven't.
Thank you, Dr. Kaufman. And I appreciate you bringing that up because that was a question posed in the chat that does coincide with this, is about partnering with schools and utilizing their ability to track student progress and also where students and families may be. So thank you for answering that question. This is probably a good question for Tim Johnson. Can you briefly describe the steps taken of turning ideas and practices into actual state or local policies?
Yeah, certainly. So I can give you sort of the statewide perspective. Having been a part of the Ohio Lead-Free Kids Coalition, we're really guided by our members, right? And like I said, there are over 40 members of the Lead-Free Kids Coalition now from all different backgrounds. Some of it related directly to lead, others tangentially, but they all bring a different and unique perspective to what they think should be done in order to tackle the issue of childhood lead poisoning. So we really listen to them at our monthly meetings to figure out what things that they're seeing. And then we try to translate that into policy action. Again, the investment of $6.5 million came after years of discussion with our Lead-Free Kids Coalition and working consistently with the Ohio Department of Health, having meetings with them, working alongside legislators, some of the ones on the call, to really emphasize the importance of making sure that there's funding available for local communities who want to do the work, who want to see change in their communities, but simply don't have the resources. In terms of a local success story, I'm not a member of this, but I'd be more than happy to, after the call, plug you in with somebody from the Lead Safe Cleveland Coalition, who has really just done some great work on the ground locally, passing their own lead ordinances and putting in place all sorts of programs. And they're really guided by their parent groups. They're guided by the city of Cleveland and public-private partnerships as well. And they have really done just some amazing work to try to make this a big emphasis on that city. So certainly happy to connect you with somebody who can give you more of a local example, but statewide, it just involved listening to our coalition members, and then working with folks at ODH, and then working with legislators to translate that to policy success.
Thank you, Tim. And now we'll turn it to Senator Sykes for a question.
Thank you. You all have indicated that about 50% of our kids have detectable lead in their blood. So, how much harm is this causing, and is it possible to reverse it at all?
Dr. Tien, do you want to take that first?
I'll start with it. I think Dr. Kaufman also mentioned, we know that there's no known safe level of lead, so we, of course, would love our levels to be zero. We, in all our kids, unfortunately, as maybe just starting with the second part of your question, there really is no evidence that we can reverse the damage done by lead. once it's had its effects. We can try to provide kids as much support educationally once this has happened, but we definitely know that lead has permanent effects on learning, attention, behavior, and that's why it's such a devastating toxin. It does seem like studies that have been done show that higher lead levels have the higher lead level, the more dramatic effect it can have on lowering IQ. As an example, there's been studies looking at that type of effect. Obviously, the higher the lead level, the more terrifying. But you're right. Finding even a level of 1 is significant, and even in those families, we know we want to make sure that we're giving them all the precautions so it doesn't get any higher.
Yeah, the other key aspect is there's the level, but there's also the duration of the exposure. So a child who visits a grandparent in an older home for the afternoon is very different than the child living in that home the full year. And the number of years and all that, contributes to duration of exposure. So testing kids early at age 1 and 2 is a whole lot better than waiting till they're 3, 4, and 5, 6, where they've already been exposed for a long period of time. In terms of the lower limit, there is no lower limit. And Dr. Herb Needleman, who's really the pioneer in all this, was asked in a 2005 interview before he passed away about this lower limit. And he said, there's different mechanisms that impact the brain and nervous system in particular, and that the lower levels probably saturate some of these at a point where there is irreversible damage, including on intelligence. So he was aware of this and even talked about levels of 1 back then, before there was technology to measure it. So it's a huge challenge. We need to, I think, address the most severely impacted kids first before we sort of get to the 50% who have just the lower levels. But we ideally, in the end, want to get down to 0.
Just a quick follow-up, is testing required?
Good question, Dr. Sykes. It is written into Ohio law that children who are on Medicaid insurance or who live in a high-risk zip code require testing at 1 year old and 2 years old. Having said that, we see that many patients do not get testing in a timely fashion, and there's not really any sort of punishment that we have put on providers for such things, but we all know we need to try to do better in that regard. But it is written as state law.
Thank you. Thank you. I appreciate it.
Are there any additional questions? I did have one kind of going along with Senator Sykes' question regarding regulations of homes that are older. I think Dr. Kaufman mentioned that Ohio has quite a few homes built before 1980, and that's part of the issue at hand. So what kind of regulations are there for both renters and homeowners on these older homes?
Tim, that's for you.
Sure. So one of the regulations and one form of primary prevention that was passed back in 2010 was this concept of the repair, renovation, and painting rule, which requires that any work that's done in an older home has to be done in a way that's lead safe, and you have to be certified and trained to be able to do that work in a lead safe manner. It's a federal rule that's enforced federally. There are 14 states who implement their own enforcement of it, but the US EPA handles it for all the other states. I know Ohio has tried a couple of times to get that to be implemented here at a state level, where our Department of Health can really work with some of the contractors who do work in older homes to make sure that they're doing it in a lead safe manner. And that has not been successful, unfortunately, though we will certainly keep trying to see Ohio be able to implement that program. But unfortunately, we know that sometime when this work is done in older homes, it disturbs lead paint. It stirs up lead dust, lead paint chips falls off, kids ingest those, and then they end up becoming lead poisoned. So it is a really important primary prevention tool because when done properly, it's done in a way so that kids never become lead poisoned in the first place when this work is done. So that's one of the requirements that has been a big focus for the Lead Free Kids Coalition. It's something that we've been advocating that the state get more involved in and try to enforce. And it's something we'll continue to advocate for as well. I mentioned in my presentation also that the Department of Health does have some funding to allow for contractors to help with the training and certification costs of RRP. But unfortunately, they're not able to administer the program themselves and really grab onto the reins of this and make sure that it's being done in a safe manner. But we'll continue to advocate that happens.
Thank you. Representative Richardson.
Thank you. Thank you to all the presenters. Really, really important information. My question is, I know we talked about removing and replacing the piping that has, the lead piping. What I'm wondering is water treatment facilities. Are we actually able to remove the lead in our water treatment facilities as we do this in tandem with improving the lead piping? So the question is, can we remove lead directly through water treatment facilities, through sewage treatment facilities, water treatment facilities?
Yeah, so what I've read, this is about Benton Harbor in Michigan, is that people were provided filters, but in the end they were found to be ineffective. And these are filters that are put on within the homes. I know that there's other mechanisms to go ahead and try to chelate, which is to bind the lead that's in the water. And those efforts honestly have had, I think, some mixed results, to be polite. In the end, it's about removing those lead pipes. And there are other pipes that have lead soldering that also leaches into the water.
So this is John Belt. I'm with the Ohio Department of Health. The lead issue, lead in water, is not a source issue. So it's not an issue of removing it from the pumping station or from the source. The lead pipes that are being referenced are generally lead service lines that come off the main up to the home. So yeah, it's really a street by street, home by home issue.
Thank you. My thought was that it could be done as well as replacing the piping.
So as you're probably familiar, water treatment facilities have treated the water for several decades with organophosphates and other chemicals to prevent, it actually builds up a crust or a coating on the inside of the lead service line so that the lead's not leached into the household water. A lot of the issues that we see is when there's disturbances, there's work out on the street of the lead service lines, or there's a failure. And then referencing Dr. Kaufman, there's been a couple of laws passed nationally, but finally beginning in 2014, we now require lead-free fixtures, and beginning in about 2008, we required lead-free solder for water lines within the home. So it's a complicated issue. I think I would really focus on what we heard at the beginning of the presentation, that the vast majority of elevated lead level children in this state are a result of deteriorated lead-based paint. When we start talking about lead in water, lead in cosmetics, cultural exposure to lead, lead in food, we get into what many refer to as an integrated lead level. So if a child has a blood lead level of say 10, 7 of those micrograms are maybe coming from deteriorated lead-based paint, 1 or 2 from the water, and 1 or 2 maybe from cultural or other practices, or even the soil. It gets pretty complex at low levels. We wouldn't generally identify an elevated lead level child in this state and attribute that blood lead level solely to water. We're always finding deteriorated lead-based paint. That doesn't mean water's not an issue. And when we eliminate the lead-based paint issue, then we're really looking at water, soil, cultural practices. So but to keep it simple, soil, water, paint.
Thank you so much. And it looks like Representative Russo has a question.
Yeah, just a quick plug here, and I appreciate John jumping in. Former Representative Greenspan and I actually have a lead line replacement bill that we introduced last General Assembly. We're working with the Ohio Lead-Free Kids Coalition, have worked on some improvements to that this GA. And so keep your eye out for that to be reintroduced, just based on some work that was done, especially down in Cincinnati. They've had some real success with this, but it's a long-term plan. And as John noted, often in these homes with the lead service lines, we're dealing with multiple issues, including lead in paint. That is also contributing to the elevated lead levels in children. But I guess my quick question before we run up on time here is that there was mention of the Lead Poisoning Prevention Fund, that there was opportunity and the ARPA dollars. I assume, if this bipartisan infrastructure bill gets passed in Washington, there will be additional dollars perhaps coming down, at least I know in the lead line replacement piece of this. But where does that fund stand right now? Are we in and I don't know this, but are we in our wisdom in the legislature actually using those ARPA dollars and putting money into that fund to be used for these lead abatement and lead line replacement efforts?
So to my knowledge, no ARPA dollars specifically have been appropriated for lead poisoning prevention at all, other than what might be able to be used in House Bill 168 regarding the Department of Development's water and sewage quality grant program that they're going to start. Perhaps some of that funding could be used for lead service line replacement. I'm not 100% sure if that's going to be one of the uses or not. But as of right now, I don't believe that there have been any ARPA dollars appropriated for any lead poisoning prevention efforts so far. That is certainly something we would advocate. And as members get ready to introduce bills around the spending of ARPA dollars, certainly the Lead-Free Kids Coalition would love the opportunity to weigh in on that and make sure legislators understand the importance of lead poisoning prevention. But as of right now, I'm not aware of any dollars having been appropriated from ARPA for that.
And when you say appropriated from the General Assembly, we can't use them according to the federal guidelines on how the money can be spent, correct?
Correct.
Okay.
This is Senator Hackett, but one thing that I saw, and if you talk to Job and Family, we were told by the feds there wouldn't be as much discretion and that we would have to follow them. But then in the last minute, we've seen more and more discretion and more. I'm on the controlling board. So we've seen more and more discretion and the ability of the state to decide on that. So has anything changed in the last month of what's come down from the feds? Does anybody know of the use of ARPA dollars?
I am not aware.
Okay.
perhaps something that all the legislators will need to look into now. So thank you so much for that. And it looks like we are up on our time. I want to say thank you again to all the panelists for joining us today. You gave us a really informative discussion of this. And I hope that as we recognize the work that needs to continue to be done, we can all in the legislature continue working. So again, thank you all for being here today. We appreciate it.
Thank you.
Thank you. Thank you.
Thank you.
Thanks a lot.
Take care.